In this video, I will give some short idea on this each eye disorders, and we can discuss some question why answers become right and wrong. Okay, so the first question we can see about the question. A 58-year-old client reports that while gardening, the client suddenly noticed several flashes of light in the right eye, followed by numerous new dark spots. Okay, so we can mark the highlighted points. The 58-year, the client reports while gardening, what is he noticing? Suddenly he is noticed several flashes of light in the right eye. Okay, followed by numerous new dark spots. The client now reports the dark shadow moving across the right side of the visual field. So, when we are getting a question, we need to look at the what's the significant symptom which is complaining by the patient. In this scenario, the patient is saying that he has noticed several flashes of light. In addition, he is noticing numerous dark spots also. Okay, so while the patient is complaining with such complaint, we have to think about it. In which condition this is noticing, because the significant symptoms like flashes of light and the feeling of flutters, okay, and the feeling of cobweb or dark spots, in which condition it is presenting, we have to analyze it. And also we can find out what the question is asking. The client now reports a dark shadow moving the right side of the visual field. That means the dark spot started to move across the right side of the visual field, because the client noticed the flashes of light in the right eye only. In addition, the client is reporting that the dark shadow which noticed, it is moving across the right side of the visual field. So we can understand the question. Okay, which finding are the priority cues? Okay, so the most concerned symptom we have to choose it, because it is not a stable condition, because suddenly the patient was doing gardening, but suddenly the client is showing the symptoms of black spot, flashes of light, and moving of the dark spot towards the right side of the visual field. So it is a SATA model question. SATA means select all that apply. There may be the answers more than one answer. So we can read the options and we can find out the answer as how the answer become right and how the option became wrong. Okay. So in this question, it's asking for the findings are the priority findings which are related with this condition. Okay. So we can read sudden flashes of light. Okay. So we know that the if any client is showing any symptoms of sudden onset of flashing of light, or that in the scenario it is written dark shadow over the visual field, that can be a priority one, because whenever, not only in this case, in any question, in the scenario if it is saying about sudden onset of symptom, okay, newly onset of symptom, or the patient is started to complain, or patient having and what a sudden loss of consciousness, like that, if anything, that means unexpected situation is coming, that can be our priority concern. Okay, in this scenario it is written suddenly the client noticed several flashes of light. So the flashes of light is a priority concern here. Okay. And we can mark this option A. Second one, new onset of floaters. Yes, of course, new onset of floaters also a priority concern. And dark shadow over the visual field. Already the client is saying that there is a feeling of dark shadow and moving across the right side of that means it's feeling of curtain. Okay. So while reading this scenario complaints itself, you have to think about what can be the possible diagnosis of the patient. So this can be the possible diagnosis. I know those who watch the recorded video or those who attend the live class might know about what can be the expected diagnosis here. Okay. And so we are taking this C also, and here it's with the history of gardening. The history of gardening is an action only, that is not unrelated with any vision problem. So we can eliminate it, option D also. And also it is saying that sudden visual field change. If the client is if any sudden change in the visual field can be a noticeable or priority concern. Okay. So we can choose the option E also. The last one, mild eye itching. Okay, mild eye itching can be sometimes occur because of the while doing the gardening. Okay, so even we can check the answers with this options. Okay, yes, the correct answers were which one? This sudden flashes of light, new onset of flutter, dark shadow over the visual field. Okay, so mild eye itching, that means whenever we are doing any gardening, no, the eye itching can be an expectable one, not a serious issue or not a unexpected one. So the answers were A, B, C, and E. So what can be this while reading the option itself, we understood about the diagnosis of the situation. What's the diagnosis? Retinal detachment. Why? Because the retinal detachment is an emergency situation. The patient will feel the sudden flashes of light, feeling of flutters, and the this shadow. Okay, the dark shadow can be over the visual field. Okay, here, there's the client-laden emergency ophthalmic dysfunction. Okay, so that's the analysis of this option, and also we can check what the, we can memorize it with the which one, the significant triad symptom for the retinal detachment, flashes of sudden flashes of light, feeling of floaters, and the feeling of dark shadow or curtain over the visual field indicating retinal detachment. Okay. Actually, these are also present in glaucoma also, but in glaucoma, the client will complain of severe eye pain. But in retinal detachment, there will not be a eye pain will be there. So you should be very clear about the in understanding the condition of the client. Okay. So we can go with the next question. In this question, the nurse receives reports about uh, for client. Okay, it is triage like question. Okay, that means the nurse receive reports about for client. Which client should be assessed first? So it is a priority plus it's a triage based question. Okay, triage means according to the severity of the symptoms, we are categorizing which patient need an immediate attention. Okay, so the first option it is saying about uh, client with gradual difficulty reading small print. Okay, that means we are checking for the most priority concern, which client need an immediate concern. Okay, and here the client with the bilateral itchy watery eyes. In both eye, the client is feeling itching and the water is coming over the eyes. Third option, client with sudden flashes, floaters, and curtain like shadow like feeling. Okay. Last one, client with a mild redness and watery drainage. So when we get such kind of question, okay, that means they will give multiple scenario and which patient need an immediate what attention. You can use the strategy here, stable versus unstable. Okay, stay, you can choose the which one are the stable condition, which one are the unstable situation. Either we can, if it is a symptom, okay, if it is a symptom, we can notice it, what can be the expected symptom and what can be the unexpected symptom. Okay, so in this scenario here, okay, in this scenario, we can read each option and we can find out which options are stable or expected finding, which condition of the patient is unstable and with the unexpected finding. Okay, so we can analyze the option one. It is saying about the client with gradual difficulty reading small print. So those who are having diminished vision, there may be a difficulty with the reading small letters. So it can be not a unexpected or it is not an unstable situation. So what we can do, we can eliminate option A. Okay. And second option, the client with the bilateral itchy watery eyes. Okay. It can be an expected or mild symptom. It is not an unexpected or unstable situation. Okay. Bilateral itching and watering can be an expected. If there is any eye irritation, we feel eye itching and the water will come through the eyes. So it can also eliminate. Okay. Next option, client with sudden flashes and floaters and curtain like shallow. See, in your options, if you are getting the term, okay, the sudden, okay, or immediately or new onset of such client need an priority consent, because here the client's situation is going into worsening stage, or this is sudden flashes of light of floaters are not can be an expected finding. It can be something related with any underlying disease of, or related with the eye. Okay, so here this can be a considerable symptom, but don't rush to the answer. We can check with the other option also. Always we will read and analyze each option. In that, which one is not suitable or which one is not compatible with this question, we can eliminate it, and which one is strongly supporting the question, and we can choose it as a correct answer. And also client with mild redness and watery eyes. Mild redness and watery eyes are not a stable situation. It can be an unexpected situation. Cannot be an unexpected. It is a stable situation only. So we can eliminate last option also. So what is the correct answer? The correct answer is, while comparing with all these four options, C is the correct answer, because here the patient is feeling a flash of sudden flashes of light, floaters, and curtain like shadow. So hope you understood about this question analysis. We can check with the answer. Yes, of course. Here C is the answer, because the sudden onset of these symptoms can be an indicative sign for the retinal detachment. Okay. So hope you understood about this question analysis, and we can. So next we can discuss about the question on the macular degeneration. Macular degeneration, we know macula is the central portion of the retina. Okay, and here what happened? Here this macula is getting atrophic changes. Either age can be a significant risk factor for macular degeneration. So what happened here in macular degeneration? We are losing the central vision. Okay, so also we are comparing with the other conditions also, all the symptoms should be very clearly understandable one. So here the question scenario, a 76-year-old client gradually worsening central vision. Okay, so in the case study they will not say about sometimes diagnosis. We need to understand the diagnosis by understanding the symptoms, priority symptoms of the patient. For patient with eye disorders can be similar symptoms and a specific symptom. So the diagnosis is based on the specific symptoms. So you should thorough with the each condition and what are the significant specific symptoms related with the particular disease condition. Okay. And here the client states, I can see the object beside me, but I have the trouble recognizing faces. So when a client is saying that, for identifying a face, for example, if it is a face, we need to clearly visible all the portions, central portion, lateral side of the patient. So, but here this patient that he has trouble in recognizing face, but he can see the object is beside me. That means he has the peripheral vision, but he is not able to clearly visible with the central vision. Okay, so what can be an indicating diagnosis here? The patient is having central vision lost. Okay, so here I can see here the client is saying that he is not able to identify the faces, and also he is having the beside vision he is having. So there is a loss of the central vision, because here can be an expected diagnosis, which one? Macular degeneration. See, this is the central portion of the retina. Here the macula is getting what? Degenerated. So the client will lose the central vision. Okay. So then what is the question here? Here the client reports the straight lines appear wavy. Okay, so that is the Amsler grid test. In Amsler grid test, what we are doing, I will explain with the question. See, this is the Amsler grid test. It is like a chart or grid chart. Okay, and it can be readable in a normal distance. That means while reading book, how we are holding in that distance, we can hold that grid chart, and we can instruct the client to locate the central point, and we can ask the client how the lines, okay, are appearing. If the client is able to clearly visible the straight lines, even focusing on the central point, the client has the normal vision. But if the client is focusing on the central dot, but the lines are, if you are appearing as a wavy pattern, there can be the diminished problem or the vision impairment with the macular degeneration, because he is having the problem with the central vision. Okay, this is the Amsler grid test which is using for macular degeneration. Okay, so here the by assessing the condition and assessing this which one word the priority symptoms, we understood that what is the diagnosis of the client? The client, it is not a retinal detachment. Retinal detachment means retina is peeling out from this epithelial tissue, and there are significant symptoms, feeling of flutter, sudden flashes of light, and the feeling of curtain over the visual field. But these symptoms, this uh, saying about the worsening of the central vision. So it can be related with the macular degeneration. Okay, so it is not a which one? Conjunctivitis means inflammation of the conjunctiva. Conjunctiva is the transparent membrane which covers the sclera. So strabismus means misalignment of the eye. That is not a condition. So here we can eliminate option A, we can eliminate option C, and we can eliminate strabismus. Okay. So the correct answer is macular degeneration is the correct answer. So hope you understood about this macular degeneration. Okay. And see, in this question, just say we are comparing two conditions, the client with a different condition. Okay, one client, okay, client A, he is complaining with sudden flashes of light, new floaters, and the curtain over the vision. Second client is complaining about gradual central blurring, difficulty reading, and wavy lines. Okay, so we know in what are the conditions are having such kind of symptom. Okay. Here, for the interpretation, we need to choose the correct interpretation. Both clients most likely have conjunctivitis. No, the given symptoms are not related with the conjunctivitis. Conjunctivitis means what? Inflammation of the conjunctiva. So the other name of the conjunctivitis, pink eye. The client will show which one, the red eye is the significant symptom of this conjunctivitis. Okay, so that is not related with this, the given symptoms are not related with this conjunctivitis. So we can eliminate option A. Second one, client A likely has acute macular degeneration. Client B has retinal detachment. See, here the sudden flashes of light, floaters, curtain over the vision, that is not related with the here it is given acute macular or atrophic macular degeneration. No, the symptoms are not related with the macular degeneration. So it did not be a possible one. Second one, the client B has retinal detachment, but client B is saying about gradual central blurring, difficulty reading, and wavy lines. That means there is no which one? The given symptoms are not related with the retinal detachment. In the retinal detachment, the sudden feeling of flashes of light, floaters, and this curtain over the vision can be the significant problem. So the client, and here the client is saying about gradual central blurring. Central vision lost in case of macular degeneration only, not in retinal detachment. Okay, so we can eliminate option B also. Next one, client A has retinal detachment, client B has macular detachment. Yes, it can be the possible answer for this question. Why? Because this three symptoms, triad symptoms are related with the retinal detachment. The central blurring can be related with the macular. It can be the possible answer. We can lock it, but we can analyze the last option also. Both clients most likely have glaucoma. It is not symptom related with the glaucoma. Glaucoma, there is an increased intraocular pressure, and here the given symptoms are actually the first the three are related with glaucoma, but it is not a significant symptom related with the glaucoma. So it is wrong answer. So what can be the correct answer? Option C can be the correct answer here. We can check it. Okay. So I am marking it. Client A has retinal detachment, client B has macular degeneration. So we can check, yes, that is the correct answer, because the symptoms are related with the Macular degeneration is the central vision distortion, and sudden flashes of light filling of floaters and curtain is related with the retinal detachment. Okay. And next question. Here it is the scenario that a client diagnosed with the wet age-related macular degeneration, scheduled for treatment. Okay, so we need to know what is happening in wet macular degeneration. Mainly two types of macular degeneration are there. What are the dry and wet? Okay, in dry means what? There is atrophic changes can occur, and there is a deposit of the drusen. Drusen means a yellow deposit can be present in the which one near the retina, okay, or under the retina. But in wet macular degeneration, what happened? There is a formation of new blood vessels near or beneath the retina. Okay, so what happened means there can be the fluid or blood or fluid can be leaked into the retinal tissues. Okay, the main pathophysiology, there is a abnormal angiogenesis or abnormal formation of the new blood vessel. This blood vessels can be very thin or fragile, and it can cause the leakage of the fluid and blood into the retinal tissue. That is can leads to what? The macular degeneration, atrophic changes can occur. In addition, there may be rapid loss of the retinal uh, deterioration can be occur. Okay, so I can see this one is the okay, that means this macular, there is a, if there is a wet, there may be presence of fluid or a blood. Okay, so in the question it is asking about what can be the treatment should the nurse expect. So first we need to know about what is age-related macular degeneration. Okay, wet age-related. In wet age-related macular degeneration, what is the significance? And there may be the formation of new blood vessel. That means abnormal formation or abnormal growth. So what is the primary the management related with primary means the medicines which are using for this wet macular degeneration means to prevent the angiogenesis we are administering anti-growth factor. Okay, here the VEG means anti-VEG means anti-vascular endothelial growth factor. That means this is the this will prevent the growth of this new abnormal formation of the blood vessel. Okay, the anti-vascular endothelial growth factor. Okay, so it can be the treatment of choice for this, which one? Wet related macular degeneration. But we can go with the options and we can find out it. Okay, the first option, intravitreal, that means into the eye, we are directly administering what? This anti vascular endothelial growth factor. Okay, it can be the answer, but we can look for the other options also. Oral antibiotic, eye patching, corrective lenses alone. Oral antibiotic, it is not an infection. Okay, it is a abnormal, which one? The formation of the new blood vessels in the macular region because of the age related change, and there is a it can leads to what? The distorted vision or atrophic changes in the macular region. So there is no need for an oral antibiotic. So we can eliminate option B. Then eye patching is not necessary for this macular degeneration. Okay, corrective lenses are alone will not work for the macular degeneration. So what is the treatment of choice for the wet macular degeneration? Intravitreal anti-vascular endothelial growth factor can be the treatment of choice for this wet age-related macular degeneration. Okay, so hope you understood about this. Okay, so. So this question is related with the viral conjunctivitis. Conjunctivitis means what? There is inflammation of the conjunctiva. Okay, I can explain with this along with the picture. So the interconjunctivitis means what? The conjunctiva is the transparent membrane which protect the sclera. So when it is getting inflammation or infection, what happen? The eyes will appear red in color, and also there is a with the secretions will be there. And if it is a bacterial conjunctivitis, the secretions will be purulent in color, but in case of allergic and the viral conjunctivitis, the tears will be in watery secretions will be there. Okay. So here asking about the viral conjunctivitis. Okay, so this is the eye which is can notice in the bacterial conjunctivitis. So the in viral conjunctivitis mainly we can ask for any history of any recent viral in upper respiratory tract infection. Okay, and the eyes appears red in color. The discharges can be clear, watery clear, and the tearing will be there. Okay, and if it is also contagious one, contagious means it can transmit. For example, if one eye has infected with the viral conjunctivitis, the other eye is also risk for getting this infection. Okay, so here it is contagious. In addition, this can be transmissible to other person also because it can spread from one person to another person also. Okay, main thing in the viral conjunctivitis we need to look about red eye, watery eye secretions, and there is a risk for spreading of the infection to other person. Okay, so we can go with the questions here. It is asking about which findings are characteristics of the viral conjunctivitis. So we should know what is viral conjunctivitis. So there is a presence of watery eye discharge. Yes, of course, because it's as not a bacterial, the eye discharges may be watery discharges only. We can check it. Recent upper respiratory tract infection. Of course, we need to ask for any upper respiratory tract infection because it can be occur because of this which one the recent upper respiratory tract infection can lead to viral conjunctivitis. Redness is there. Yes, of course, there is eye can appear as a red pink. Then next option, high contagious. Contagious means it's a communicable. It can spread from one person to another person. Of course, it can also present. And next option, thick purulent discharge as the primary finding. Actually, thick purulent discharge as the primary finding. This purulent discharge is mainly present in the bacterial conjunctivitis. It is not related with the viral conjunctivitis. So, it can be a option can be eliminated. Last one, severe itching as the dominant symptom. So, severe itching can be there, but it is not a dominant symptom. Means this can be also what can be eliminated because severe itching is not a dominant syndrome because there are other symptoms are also there. Redness will be there, watery eye discharges will be there. No, we can check with the answer. Okay. So mostly the answers are which one? A, B, C, and D. Because severe itching alone cannot be a dominant symptom for the viral conjunctivitis. So the answers are watery discharges, recent upper respiratory tract infection, redness, and high contagious. These are the significant symptom which supporting the viral conjunctivitis. So hope you understood about this the symptoms related with the conjunctivitis. Okay, so the purulent discharge is seen in the bacterial conjunctivitis. Severe itching is not a dominant symptom in the virus. So the last two options are eliminated and we can take the answers A, B, C and D. Okay. Mm, So see, these are the main significance difference in the types of conjunctivitis. Mainly three types are there: bacterial, viral, and allergic. Okay, and in case of thick purulent discharge, it present in the bacterial conjunctivitis only. Okay, it is absent in viral and allergic. Okay, so it is present in the bacteria. And the watery eye discharges, we know in bacterial there is which one? Purulent discharge. So watery discharge with the recent upper respiratory tract. Watery discharges can be also present in allergic conjunctivitis, but it is asking about water discharge plus recent upper respiratory tract infection. It is related with the viral conjunctivitis only. Okay. Severe itching can be present in allergic only because the allergic is the main cause for the conjunctivitis. So severe itching can be present in allergic conjunctivitis only. It is absent in bacterial and viral. Okay, bacterial and viral. And here, pollen exposure. Pollen is a allergen. So, it is not related with the bacterial or viral. It can be related with the allergic conjunctivitis only. Okay. So, it is absent in bacterial and viral. So, eyelid stuck. Okay. Eyelid are mainly stucking in bacterial conjunctivitis, not in viral or allergic conjunctivitis. Okay. So, because of the thick presence of the thick purulent discharge, the eyelids are stucking together because the eye secretions will be there. So eyelids are stuck in case of bacterial conjunctivitis only, and it is absent in viral and allergic conjunctivitis. Okay, and highly contagious. Mostly bacterial and viral conjunctivitis are highly contagious, and this allergic conjunctivitis is not a contagious. Contagious means it can be spread from one person to another person. It's not related with this allergic conjunctivitis. So these are the main three difference in findings of this three types of conjunctivitis. I have explained everything in the theory. Okay. So 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 far, I have discussed about the retinal detachment, macular degeneration, and conjunctivitis. Okay. So next topic, it can be related with the C. We can see about this ocular melanoma. Ocular melanoma means what? There may be the presence of abnormal, which one? The tumor. Okay, abnormal growth of these tissues can be occur either in ciliary body, iris, or in choroid layer. Okay. So here in this question, the client reports new pigmented lesion on the iris accompanied by visual changes. Okay. So there is a pigmented lesion on the eye, on the iris region. Okay. And it is accompanied by vision changes. So what can be the condition should the nurse consider? Okay. So option A, ocular melanoma. Option B, conjunctivitis. Option C, presbyopia. And last one, myopia. What can be the significant symptom of the diagnosis for this patient? New pigmented lesion on the iris. Okay, and there is a vision changes. What can be the symptom here, the diagnosis here? Anbu, you can conjunctivitis. It means inflammation of the conjunctiva. It is here we are occurring the red eye only, not a pigmented lesion. Okay. Presbyopia and myopia are the refractive errors. That is, there will not be a pigmented lesion. So, what can be the possible diagnosis with this condition?
Ma'am, A, ma'am.
Yeah,
Ocular
that is
melanoma.
ocular melanoma is the significant diagnosis which relating or supporting this patient complaint. Okay, yes, that is the correct answer. Okay, whenever in your case study you are noticing any new abnormal pigmented lesion on the eye, it can be related with this ocular melanoma. Okay, and see one question here. I noticed a new dark spot in my eye, the patient is saying, but it doesn't hurt. The patient is not having any pain, and the patient is noticing a new dark spot on his eye. So, what can be the expected the which one the condition by the symptom itself? We should remember it. Then the question is, what should the nurse do? Okay, tell the client the pain is necessary before evaluation. So option B, recommend prompt ophthalmic evaluation. Option C, tell the client to rub the eye. And the last one, reassure the client that all pigmented lesions are harmless. What can be done? What can be the possible answers for this client statement?
Ma'am, recommend from
Mm.
prompt ophthalmic evaluation.
So why you have chosen that answer?
Pigmentation, it's they say the pigmentation, the
Yeah,
pigmented lesion are harmless. No, it's we have to evaluate that. That's wrong answer.
yeah,
And tell the client to rub the eye. You should not rub the eye when
mm,
these conditions happens here.
yeah,
So the both are wrong answer.
yeah,
And
okay.
tell the client pain is necessary
Mm,
before evaluation.
mm.
It doesn't make any sense, ma'am, for me.
Yeah, it's the wrong
So
statement. So
yes, ma'am.
it can be also eliminated. So what can be the correct answer? Option B. Recommend prompt
Recommend.
ophthalmic evaluation can be a Correct answer. We can check the answer. Yes, of course, because melanoma is a which one metastatic tumor in the eye. So will not be a some. It can be in on initial stage. What it can be painless. In later stage only, it can come with the patient will experience with the pain. So any changing in the the eye color or any development of any pigmental lesion, it can be an indicate sign with the ocular melanoma. So it can be evaluated by the ophthalmologist on an emergency basis because we need to find out, we need to make the condition diagnosed to start the treatment. Otherwise, it can go into metastatic stage and can be life threatening. Okay. So, this question, can you please read it and I will explain later with the question. Yeah.
A chemical splashes into a
Mm.
client's eye.
Yeah.
Which action should the nurse take?
Mm.
Begin immediate irrigation,
Mm.
all the eyelids open,
Mm.
continue copious irrigation as directed,
Mm.
wait for the provider before starting irrigation,
Yeah.
attempt to neutralize a chemical with another chemical,
Mm.
arrange urgent ophthalmic evaluation.
Yeah. So it is
Uh,
can be which one? Chemical injury. Okay. So we need to know about what are the management, first aid management, what are the immediate management can give given for a patient with the chemical injury. So can you, and here option, question is which action should the nurse take? The priority nursing action is the question. Okay. So I think it's a SATA question. I don't know. Nothing has mentioned. We can you please consider it as a which one? SATA. Ah, yes, it is a SATA question only. Okay, it is a SATA question, and you can analyze each option, and you can tell me which answer I need to choose it, which option I need to eliminate it, and give me the rationale also, explanation also, why you are choosing as a right, why you are choosing as a wrong. Okay, understood? So you can
okay,
tell me. Yeah, you can tell me what's are the first option.
begin immediate irrigation.
Yeah.
Yes, ma'am. We have to do because
Mm.
when patients comes with the chemical splashes, we
Yeah.
have to irrigate immediately. We should not wait for any of the
Mm.
healthcare provider orders. Just
That means
start irrigator.
we should not delay the irrigation
Yes.
for waiting for the complete assessment, for waiting for the ophthalmologist evaluation. Immediately, our focus is to complete elimination of this chemical from the patient eye. Okay, so that can
Yes, ma'am.
be the correct answer you have chosen. Second one, hold the eyelids open. Is it needed for the irrigation?
Uh, I don't think so, ma'am. All keep open the eyelid. Um, I don't know, ma'am. We'll keep for a hold, ma'am.
You are keeping as a hold. Yesterday I have said it. Okay. Next one. Continue copious irrigation as directed.
This copious meaning.
Mm.
Uh, copious means
No, copious means that
I
whatever the hospital policy, which one is as for example, sometimes it can be normal saline or can be sterile water. Okay, whatever is this one, we can,
okay.
yeah.
Okay, it depends on their policy. Then it
Mm.
might be a right answer.
Mm.
Then wait for the provider before starting irrigation. No,
Mm.
ma'am. We should not wait for the provider. We should
Mm.
start immediately. So
Okay.
A and C is right. Then
Mm.
attempt to neutralize the chemical with another chemical.
Mm.
No, we should not neutralize any chemical
Mhm.
when patient come with the chemical splashes.
Mm.
Then arrange urgent ophthalmic evaluation. Yes, we
Mm.
have to arrange ophthalmic evaluation.
Okay.
So I'll go with A,
A,
C,
C,
and F.
F.
Yes, this
And
B,
mm,
keep eyelids open. This when we do irrigated or for a
it's when
long.
when do action should make should take that means during see in the here the client is coming in front of you with the splashes of the chemicals. Okay, in what are the appropriate nursing action? That's the question. So if you are opening the eyelids by the nurse, is it appropriate or inappropriate? You can choose it. While doing irrigation, if the eyes are closed, is it possible to remove the complete chemical from the eye?
No, ma'am. No,
No.
no, no.
So is it
During
need?
irrigation, the
Uh,
patient must open their eyelids.
okay.
Then it's needed, ma'am.
Then it is needed. Okay. Otherwise, there is no need to keep the eyelids open, always open. That's only your confusion, is it?
Yes, ma'am. From the time of the flash or
Uh,
only during irrigation, they didn't mention
okay.
it. So
Uh,
that's what I got confused there. So
confusion.
if during irrigation, then eye should must be open. Without
Okay.
open, we
Uh,
cannot wash the eye.
okay.
From the
Mm,
chemical flash till
mm,
the now,
mm.
then I have confusion. If it's
That
during
means
irrigation, then it's yes, ma'am. The whole
yes,
the eyelids open.
open. Okay. So you're choosing the B also. And wait for the provider before
Yes.
starting irrigation. Is it needed?
No,
No,
ma'am.
because we should not delay the
Yes.
treatment for waiting for the ophthalmologist evaluation. Second one, the next option, attempt to neutralize the chemical with another. We should not try to neutralize with the chemical. Either it is a acid or alkali, we should not try to neutralize it. We can only can do the irrigation, and meanwhile we can inform to the ophthalmologist immediately. They can come and evaluate and they will order the eye drops. Okay, otherwise we should not try to neutralize it. Okay, it can worsen the injury. So actually for this, the copious irrigation mainly for during the copious irrigation, what we can do, start the irrigation immediately. Okay, use large amount of water or appropriate irrigation solution. We can hold the eyelids open, and after that, if the client is able to blink the eye, we can instruct the client to blink it so that it can cause what, this complete chemical, something the chemical can be trapped inside this eye, in between this eyelid. Okay, that also can be removed from the eye, so that only we are opening the eyelids. Okay, and if the client is using any contact lenses, we can remove the contact lenses, and our urgent ophthalmic evaluation is necessary. So as your answers are, what are your answers? A, is it
A,
A,
B,
B,
C,
C, F? Is
and
it
F, ma'am.
F?
Yes,
So
ma'am.
we can check with the answer. Yes, that's our correct answer. A, B, C, and F are the correct answer. Okay, so you have doubt with eyelids open, but it is saying about whenever usually we are priority action is irrigation. So at that time the eyelid should be open. It not should not kept closed. Okay. So that's the correct answer. It
Okay.
was a good analysis, Ambu. It was good.
Ma'am, one doubt, ma'am. Sorry.
Yeah, no problem.
Yeah, this one, two, three. Fourth point, ma'am. Encourage blinking if able.
Yeah. Okay,
So
sometimes
yeah,
uh,
during
blink.
irrigation,
Actually, that's what I'm saying. Sometimes client, if it is a burning chemical, for example, it is acid, the client will not. Blinking means just we are the closing and opening. Okay.
okay,
Sometimes the client will not be able to blink the eye also. If it is which is a strong acid, or if it is a strong
okay,
alkali, they cannot what move the eyes. Okay. But if the client is able to blink the eye, mean blinking of the eye can help you to bring down the chemical from the corners into the eye, so that during the irrigation it can be completely removed out from the eyes. So that only we are instructing the client to, if the patient is able to blink the eye, we can say the client to blink the eye. Okay, that is for the complete removal of the chemical from the eye. Okay, it will promote the elimination of through this solution. Okay, this which one, the chemicals can be what, eliminated out from the eye. Okay, or any further doubt?
no, ma'am. I'm
No.
clear.
Okay, okay. So here it is like a metal fragment, okay, is embedded. A metal fragment is embedded in the client's eye after industrial accident. So what should the nurse do? Okay, remove the object with the forceps, rub around the object to loosen it, protect to stabilize the eye and obtain emergency care. Last one, apply direct pressure over the object. Which can be your answer because it's a thing and which condition by reading the scenario, what do you feel? Which can be the expected condition here?
It's trauma, ma'am.
It is which trauma? It is a penetrating trauma,
Penetrating trauma, ma'am.
penetrating trauma, or penetrating eye injury. And what can be the action, correct action? What should the nurse do? That is
Ma'am,
appropriate
will we
nursing.
remove the
Mm,
yes? Will we remove the object with the forceps? It makes bleed, so it's a
yeah.
wrong answer.
Okay.
And rub around the object to loosen it will make
It can
complicated the
eye
eye injury
injury.
because it may
Yeah.
get enter
Mm.
much more, and sometimes
Deeper
it may
injury
make
can
internal
be,
bleeding. Yes,
yeah, the
deeper.
injury can be go into deeper tissues, so it cannot be.
Yeah, that will make worsen the condition here.
Okay,
And
okay.
apply direct pressure over the object.
Mm.
That also makes deeper. The object will may enter deeper, which will make
Oh, we
other
should,
complication.
it cannot be
Yes,
do because we should not
yes,
try
ma'am.
to remove the object with either with the hand or with the forceps. And also we should not rub the eye and we should not apply direct pressure over the object because it can worsen the injury into the deeper tissue. So the possible answer for this situation, protect or stabilize the eye.
Second,
Yeah, because we need to
and obtain
keep the
emergency
position.
care.
Yeah, keep the position in a stable position. That means if the client is tilting or turning or head, no, it can the injury tissue injury can go into deeper tissue, and also emergency evaluation is necessary for this client. Okay, so the correct answer can be which one? Option C
See,
can be
ma'am.
the expected answer, the possible answer here in this scenario. So yes, that is the correct answer. So which strategy we have applied here? We are just read the option and we were comparing with the scenario because it is a metal fragment is embedded in the client side. It is can be related with the penetrating injury. So what can be the options which appropriate for the situation and what can be the answer which is inappropriate. The inappropriate situations we have eliminated and the appropriate action we have choose it as a correct answer. So the correct answer is what? Protect and stabilize the eye and obtain a emergency care. Understood? Okay, good.
Yes, ma'am.
Yeah, yeah. So here also it is a priority based question. Which eye injury requires the nurse to act first? So it's a priority. Okay. First one,
Okay.
mild eye irritation from the dust. Second one, small superficial foreign body with intact vision. Third one, chemical splash into the eye. Last, mild redness after crying. Which can be the possible immediate evaluation is necessary. In which situation?
Mild eye irritation from dust
Mm,
and mild redness after crying. This not as a emergency situation here
So you,
because that might be, yeah, with the crying that must be with any dust allergies.
okay.
So that's not an emergency here.
Mm,
Here chemical splash to the
mm,
eye
mm,
and small
mm,
superficial foreign body
mm.
with intact vision.
Yeah.
Foreign body in the sense they
Mm.
meaning that any object is penetrating. No? The
Yeah.
trauma the meaning.
Anything. It is not as always. It not be a penetrating. For example, it can be eyelashes. Will be sometimes dust can and the splash over the eye and sand. Okay, any small tiny particle that is also a injury with the foreign body. Okay. So, but here the
Okay.
situation is with the intact vision. That means there is no impairment with the vision. Okay. So,
Okay.
uh, while comparing with the option B and C, which can be the possible priority scenario which need immediate attention.
Chemical
Mm.
foreign body with intact. Um, Mom, I'll go with yeah, quite confusion, but I'll do C, ma'am.
So why you have eliminated option B?
Ma'am, that's foreign body intact with the intact of vision.
Mm.
Um,
It is,
But
you can,
chemical
yeah, here you can apply the strategy stable versus unstable.
unstable.
So which situation is stable and which situation is unstable? So unstable patient need to meet first, and with
Yes.
the patient with stable we can act little later. Always the priority is unstable situation. So by comparing with this option B and C, which one is the an emergency situation or unstable situation?
The chemical splashes patient will have some irritating or any burning, so
Mm.
you will be restless here.
Yeah, because
The
here,
small,
uh,
yes, ma'am. Small superficial foreign body with the intact vision.
mm,
Something is there like we said, sand or what object it is.
mm,
But even though it's a penetrating, we
mm.
have to wait for ophthalmic evaluation, emergency
Yeah,
surgery.
yeah, yeah, yeah.
So the nurses can do the best thing is
Mm.
to do irrigated with the
Yeah, very
chemical
good.
splashes patient.
But to remove the chemicals from the eye. So
So
this
it
can be the
comes with
most.
the nurses scopes.
Yeah, it also, it's very good. We need to check with the scope of practice also what can we do first. Even though if it is this small superficial foreign body means there is not that much injury to the eye. See, it is already
Yes.
mentioned small superficial. That means there is no damage to the deeper tissue. And also the client is having intact vision. Intact vision means there is no impairment with the vision. So it is a stable situation only. And in addition, the chemical injury is a emergency situation because emergency irrigation is done. Okay. And as you said, if the foreign body, if it is a penetrating injury, there what we can do the head in an aligned position, and we cannot do anything. We cannot remove it. We cannot apply pressure. We cannot rub it. What we can do, we can inform the ophthalmologist and we can wait for the emergency ophthalmologic evaluation. Okay. So within our scope of practice and according to the scenario comparison, the most priority scenario is chemical injury. That means the chemical splash to the eye. Okay, we can check the answer here and we can check it. What can be the possible answer? You have chosen option C as the correct answer. What's the correct
Yes,
answer?
ma'am.
Option C, because here
See,
we are not irrigated and if we delayed the irrigation with the chemical injury, no, the rapid damage can cause in the ocular tissue. So here immediate irrigation is necessary. That's the priority here. Okay, understood?
okay.
So
Yes,
good
ma'am.
analysis. See, that's the power of class, is it? When you
Yes, ma'am.
when you listen the class carefully, even if it is attending lively, you will easily get what idea about the theory, clarity, even you can clarify the doubt even if the class itself, so it will not be even see you here you confused with the option B and C because the option B is a which one foreign body, that is also we need to manage first. Option C chemical injury, that is also emergency situation. But while comparing with these two options, which is the most concern, always we can go with if any situation affecting the safety or life of the patient or safety of the patient, that is the possible answer for us. And also if we in an emergency situation, if we do not do an prompt action, it can worsen the condition of the client because it can go into complication. So we need to minimize the complication. That should be our priority because in an NCLEX mostly the questions will be checking or assessing your ability to work as a safe RN. Safe RN means to promote the life of the patient, to promote the safety of the client, and to prevent complication, to minimize the injury. These are should be your focus. So while reading the option itself, you have to be very careful which option is causing harmful effect to the client. So ethical principles you need to always keep in your mind. Okay, that means we should not harm the client. That is non-malfeasance. What we can do, we can give beneficial effect to the client. That means beneficence. Always we should focus on the benefit of the client. Okay, we should not do any
Okay.
harmful action with the patient's life. That should be a safe RN. Okay, so hope you got that should be always kept in your mind. See, this is the ordering of this eye medicine. You can read this option, okay, and it is consider it as a drag and drop question. That means if it is we are doing the question bank, we can drag the question and we can rearrange the order. Okay, so
Yes.
read the option, read this scenario, and read the option, and tell me what are the options are needed as a priority order. Okay, so read it.
Okay.
Yeah.
Place the steps of for
Mm,
administrating eye
mm,
drops in order.
mm,
Pull down the lower eyelid. Wash hands. Ask the client to look upward.
mm,
Instill the prescribed medication into the
mm,
conjunctival sac.
mm.
Close the eye gently.
Yeah.
Um, First, wash hands, ma'am.
First, wash hands. Okay. So, yeah. Okay. Second.
Second, ask the client to look upward.
Mm,
Then pull down the lower eyelid.
yeah. Then.
Then instill the prescribed medication into the conjunctival sac.
Mm, yeah. Last one.
Then we have to ask the client to close the eye gently.
Okay. You can tell me why you have chosen this order.
Ma'am,
Mm,
whenever we are administrating eye drops,
mm,
first we should have wash our hands
mm,
and we have to ask the client to look upward to the
mm,
ceiling
mm,
so that we can able to install very easily. Then
mm,
we out then we need to pull out the lower lid,
mm,
which will make this conjunctival sac so
mm,
the drops can be poured into that.
mm,
So the whatever amount of the drops
mm,
which we are instilling, it
mm,
will completely can be get to the patient.
mm,
Then we have to ask the patient to close the eye gently.
mm, mm. Okay, that means the order before touching the medicine, always we should wash our hands. Second one, what we can do, we can ask the client to look the ceiling or look the upward position so that which one we can create a content, a pocket in the eye, okay, lower eyelid. So how we can create the pocket? Pull the lower eyelid downward, so it will create as a pocket that we are into the conjunctival sac. We can pour the medicine, and for the total spreading of the medicine in the entire eye, we can ask the client to gently close the eye. In addition, next step, what we can keep the which one index finger on this inner aspect of the eye. Why? Because to prevent the systemic absorption of the drug. But because immediately this through this nasolacrimal duct, this medicine can go into systemic circulation. So to prevent the systemic circulation of the medicine, we can instruct the client to this hold this which one the inner part of the eye, so the medicine can helping for the spreading of in the entire region of the eye. That's the step of this which one eye medicine. This is very important. Okay, so we can check with the answer. See, is it correct? The order which you have select, is it correct? That means this you can look for this here. Okay. The first you have said which one? The wash hands. Yes, two is the correct answer. Next step in then ask the client to look upward. Yes, that's the correct answer. In third, you have said pull the down pull the lower eyelid downward. So it is also correct. Next option, instill the prescribed medicine. So that's also correct. Last one, close the eye gently. Understood the order, priority order. Actually, it is a drag and drop type question. So what we can do first option, you can drag it from this position and make it the first option. Second, this if it is the rearranged one, you can make it into the second order. This can be the third order. This can be the fourth order. This can be the fifth order. Understood? Okay, Anbu? Any doubt?
No,
Hello.
ma'am.
Yeah, you are clear. Okay. One more question we can do and we can wind up because see. This question also you can read it and you can tell me the correct answer.
Yes, ma'am. Which statement indicates correct understanding of
Mm,
ophthalmic medication
mm,
administration?
yeah.
I will touch the bottle tip of my eyes
Mm,
so the drop lands accurately.
mm,
I will share my eye drops if my spouse develops redness.
mm,
I will keep the dropper from the touching my eye
mm,
or eyelashes.
mm,
I will use expired medication if I have symptoms.
yeah.
This last one is wrong answer. No. I will
See,
use expired medication. We will take it up blindly.
I will use expired
Uh,
medication if I symptom. That's a
yeah,
wrong,
yes,
contradictory
yes,
statement. Yeah. Next.
that will take it up. Here, I will touch the bottle tip of my eyes, so the drop lands accurately.
Mm,
Touch bottle tip. No, we should not tip. That will make contaminated.
yeah. That means we should not allow
That
to touch the tip of
yes,
the medicine bottle into the eye because it can become contaminated. So you eliminated option A and D.
and
So two options are remaining. Yeah.
I will share my eye drops if my spouse develops redness.
Mm,
I will keep the dropper from touching my eye or eyelash.
yeah.
We should not share this like this because he may have some other condition.
Mm,
We should not know that. So we should not share any eye drops
mm,
without consulting any doctors.
yeah.
So be also not ma'am.
Yeah.
See, I will keep the dropper from the touching my eye or eyelashes when we dropping the when we about to installing the drops. We
Yeah.
shall have to keep some eye.
So that means I will keep the dropper from touching my eye or eyelashes.
Yes.
That means we are not touching this dropper with the eyelid
Yes, ma'am.
eyelash. That is the correct
Yes, ma'am.
statement. That means other options like I will touch the bottle tip to eyes. That's a contaminate. The bottle medicine bottle will become contaminated. That's a wrong action. Second, I will share my eye drops with if my spouse develops symptom. That means that's wrong because we should not share the medicine if it is used by one infected person. And I will use expired medication if I have symptom. That means expired medicine, that is a contradictory. We can directly eliminate it. Expired medicine, we cannot use it. So the answer is I will keep the dropper from touching my eyes or eyelashes. That is the safe administration of the medicine. We are not touching in the eyelid, eyelashes, or this which one? The inside of the eye. And here we are protecting from getting infection also. So the correct answer is option C. So we can check the answer. Yeah, that's the correct answer because we need to maintain sterility to prevent the contamination of this medicine bottle. Okay, what do you feel this question analysis? The theory plus the theory, to make the theory only, I'm discussing such kind of questions. So it will make the theory more thorough. So it will helpful for your, which one? The question bank question analysis. So what do you feel, Anbu? Yesterday you have attended the live class and today you are analyzed the question very easily because some options you felt some difficulty, but difficulty means some confusion, mild confusion, but you have analyzed in a very proper way. So that means I am asking whether you are day by day your question analysis getting improving. Is it
Yes,
gradually?
ma'am.
Yeah, gradually you have to focusing on the now you are sometimes you are feeling some confusion with some option, but when we do the gradually when the consistently we are practicing question, no, that confusion also we can word eliminate it. We can even by reading the option itself we can log the answer. Okay, so we can do it, we can make it possible, don't worry. Okay, so thank you
Thank
for
you.
yeah, thank you for joining, and can I wind up the class today? Yeah. Okay.
Yes, ma'am.
Yeah, you
Yes,
can
ma'am.
watch the recorded because it will be helpful for you. How a scenario
Okay.
can be read and how we can uh, apply the theory. I just review the theory in a short little bit explanation only. I review the theory with this question analysis so that it will helpful for you. Okay. Thank you. Thank you so
Okay.
much. Yeah.
Okay.
Thank you.
Thank you.
Oh, okay.